Good evening, everyone. This evening, I have the great pleasure of having three esteemed guests on to speak about a very important topic in Canada, the doctor shortage. I'm sure, as many of you are aware, there are many communities in Canada across this country and in our province as well here in British Columbia, where many folks do not have access to a family physician. And so to discuss that doctor shortage and the doctor shortage in the healthcare system overall, we'll touch on the shortage in specialists as well and things like that. We have three panelists with lots of experience in this area. And so I will let them introduce themselves, and please do have a listen to what we hopefully is a very informative and interesting discussion.
Would you like me to start?
Sure, go ahead, please, Rosemary.
My name is Rosemary Pawliuk. I'm a retired lawyer by profession. I worked for more than 30 years in the field of legal issues related to injury and healthcare. I also have a disabled son, and so I have been heavily involved in the medical system for many, many years. I'm the president of the Society for Canadians Studying Medicine Abroad, and we call ourselves Chasma for short. We seek to bring down barriers to physicians who graduated from international medical schools, which prevent them from being licensed in Canada and serving the Canadian public. In 2013, our society established a research team to work to understand a system that simply made no sense to us. There was a tremendous lack of physicians. It's gotten worse since then, but at that time we were thinking this simply doesn't make sense, and the lack of transparency and lack of accountability by those who govern access to medical licensing, especially the Ministry of Health, the faculties of medicines of the universities, and the College of Physicians and Surgeons of Canada, made accessing information that should be available to all of us a challenge. And it took years of persistence and appeals and requests through the Freedom of Information legislation to get the information that we have today, which certainly has helped us understand the motivations, the interests, what drives the system, and how it's driven. Thank you.
So I will introduce myself now. My name is Dr. Humaira Batool, and I'm a medical graduate from Pakistan. I will not call myself as an IMG. So I started my career as women medical officer, and then I did a diploma in gynecology and obstetrics from King Edward Medical University in Pakistan, and I have been working as a gynecologist. And I established a gynae unit in a rural area of Pakistan, and I was able to bring some changes in maternal and infant mortality in that area. Then I went to Australia and I did 2 years master's in medicine in STIs and HIV from University of Sydney, Australia. And then I came back to Pakistan and I did my MCPS in family medicines. And then since then I have been working in a family medicine in Pakistan. And I recently moved to Canada about 6 months ago. And I would like to express my feelings. Like throughout my life, I have been working as a doctor, and I have been doing surgeries in gynecology and obstetrics. I have been treating the patients, and here I cannot do things like this. And I have a feeling as somebody has chopped my hands. That's how I think. It's not the feeling of myself, it's that's how all IMGs have this feeling. It's same for everyone. That's it.
Thank you very much for having me. My name is Vahid Nilforushan. I'm an anesthesiologist by training. I practiced for about 13 years in anesthesia, critical care, and opioid addiction treatment before moving to Canada in 2010. I pioneered a method for opioid addiction treatment in Iran, which led to the establishment of the first inpatient addiction treatment center in the country. And I graduated with the highest distinction in medicine from one of the leading medical universities in Tehran, Iran. And also I ranked first in the whole country when I finished my anesthesia residency. I have passed the Canadian medical exams, English language proficiency after immigrating, and I have done 3 years of supervised clinical practice in BC, which included over 2 years of practice at Vancouver General Hospital. I applied to medical residencies for 5 years, and I didn't get any interviews in anesthesiology. I got a few interviews in family medicine residency, but I was not matched eventually, and I still don't know why. I am currently the president of the Canadian Society for Immigrant Physicians Equality, or COPSIS, as for short, and I have been involved in teaching and research in BC as well.
Thank you, Vahid. I am still here, wondering why my camera turned off. But please, okay. Thank you so much for your introductions. We'll keep rolling here. So I guess, yeah, the grand question, do we have a doctor shortage in Canada? To what extent? And international medical graduates and foreign trained doctors, what role do they play in the potentially resolving or being part of a solution to this problem?
Well, if I might jump in, the question, is there a doctor shortage? There are currently 5 million Canadians who cannot find a family physician. We wait months to see a specialist. People experience severe mental illness, generally wait months, and in some cases over a year to see a psychiatrist. We wait months and even years for surgery. However, it is an uncontroversial fact that there are thousands of medical doctors in Canada who have met the Canadian standards by passing the Medical Council of Canada examinations, establishing that they have the education and skills expected of a graduate of a Canadian or American medical school. The problem is that our government has erected barriers which prevent them from becoming licensed to practice. And these barriers are a function of the government's fiscal policy. In the early 1990s, Canadian provinces adopted the Barer-Stoddard economic theory of healthcare management. And it's a very simple theory. If we control the number of physicians, we control public access to healthcare, and thus we control healthcare spending. So from the government's perspective, the correct number of physicians is not related to public need. It is a simple matter of dividing the provincial allocation of healthcare budget for physicians by the average cost of a physician. So when the Barer-Stoddard economic theory was adopted by provincial ministries of health, the number of physicians that Canada trained dropped dramatically. And because we have a government-controlled universal healthcare system, it is a very simple thing for the government to control the number of physicians by controlling the gateways to licensing. Without a license, you can't practice. So if you'd allow me to explain, most immigrant physicians and all new medical graduates must work in an entry-level job as resident physicians before they can become fully licensed to work in Canada. And so the provincial ministries of health control the number of these residency positions for the purpose of controlling the number of physicians who can become licensed to practice. And they have a monopoly over this. And in 2011, a government report in British Columbia stated that there are municipalities, community groups, and large corporations who are so desperate for physicians that they would fund residency training positions so the government wouldn't have to dig into its pockets to pay. But the provincial government did not allow this. If it were to allow municipalities and other Canadian institutions to fund residency programs. And if they were allowed to do it in that way, the government would lose control of being able to control the number of licensed physicians. And so I would like to give an example using BC as the example. Last year, 515 physicians stopped practicing medicine in BC. So 515 stopped practicing. This last year, BC funded training of 349 new resident physicians. In addition, there were 30 immigrant physicians who were individually assessed. So that's a total of 379 new physicians. Thus, BC was short by 136 physicians for only keeping at an even level. 515 resigned. We lost 515 and we trained 136. Now you would think because of the additional demand caused by COVID, logically, we'd expect the ministries would be training more physicians. Considering physician burnout, doctors are quitting, they're talking about the collapse of the medical system, but that didn't happen. For the year before last, BC trained 352. So they trained, after COVID, the Ministry of Health reduced the number of people that it trained. So across BC, it was reduced by 3. Across Canada last year, after we knew the impact of COVID, the number of physicians that were trained was reduced by 32. Now, from a public point of view, this might be shocking, but it in fact is predictable when viewed in the context of the fiscal management theory from which Canadian healthcare operates. Although the government presents a narrative that it's working to meet Canadian healthcare needs, this narrative is created to assuage the public for political reasons. The narrative is contradicted by the facts. Last year, 1,483 Canadian citizens and permanent residents who of that number of 1,483 permanent residents, 1,421 of whom graduated from reputable international medical schools and passed the Medical Council of Canada exams and were qualified to work as resident physicians. They are not practicing today, not because they haven't had their credentials recognized, not because they are a threat to public safety. They are not practicing today because the government restricts the number of entry-level positions to medicine and does not allow them to work. Studies report that most of these people are literally driving taxis.
Yeah, actually, I also have some statistics. It says that Canada ranks 26th worldwide in physician to patient ratio at 2.8 doctors per 1,000 people, according to Organization of Economic Cooperation and Development. And that's about half the number in some other developed countries like Norway. In Norway, this ratio is 5.3 to 1,000 people. And as Rosemary has already mentioned, that Canadian Medical Association estimates 5 million Canadians don't have a primary care physician. And currently, there are more than 13,000 internationally trained doctors in Canada who are not working as doctor. And according to Internationally Trained Physicians Access Coalition, of these doctors, 47% are not in the healthcare field at all. So there is a huge talent which is wasted. And even as Rosemary has mentioned, that even passing all the examination, they are not allowed to work in the healthcare system.
I'd like to add that the reason that international medical graduates are here in Canada is because the immigration authorities say that there is a shortage of physicians in Canada. That's the reason that they expedite the immigration of physicians from other countries. So when I applied, my application was expedited and I was allowed to immigrate in less than 2 years. So, but I have been here for about 11 years and my potential has actually been wasted while they say that there is a shortage of physicians. On the other hand, some people in the medical establishment say that there is no shortage of doctors. So on April 8 to 2020, the Federation of Medical Regulatory Authorities of Canada, they said that there is not a physician shortage at this time, nor it is anticipated. So that's what the FMRAC said at the time. And that's very interesting. You see many, every one of us know someone around who doesn't have a family physician. And in regard to anesthesiology, you probably know that there is a huge need to anesthesiologists in BC. If you go to the website of healthmatchbc.org, which is working with the College of Physicians, of Surgeons of BC, you can see that there is a separate category for anesthesiologists because there is a huge need. But I have been here and I have been wasted for 11 years.
And actually, Vahid, that's a really important point that you've raised because it underscores what we have learned in our research, that the driving factor is not public need, it is a willingness to pay. It's a need to control the number of physicians. And so that is so consistent with the policy that is in place. I'm a fourth generation Canadian. I was raised on Canadian values in school, and I was taught what the legal principles are in law school. And when I learned that the system as it worked today, how it worked, and that basically people who are graduate from international medical schools, there's no other way to describe them but that they are second-class citizens. What I was taught in law school, what I was raised on from elementary school all the way to high school was that once you became a Canadian, and it didn't matter if you were born here, if you immigrated here, if you were a refugee, once you became a Canadian, everybody had equal rights. And yet, because medicine has so got off the foundational rails of fundamental principles of justice, that it segregates graduates from international medical schools and graduates from Canadian or American medical schools with the idea to protect the lowest, the person who barely gets through medical school in Canada or the US. They will become doctors. But people like Vahid, who who I know from my own connection, that the United Nations was so impressed with his addiction clinic that they sent a contingency there to research it and to duplicate it for world benefit. He cannot practice. There is no avenue within British Columbia by which Vahid can become licensed. The door is shut on him. Wow. He can go, there are some small openings if he went to other parts of Canada that he could squeak in to become licensed. But in British Columbia, no avenues are open for him to become licensed because our main policy fiscally is to control the number of physicians who can be licensed, because that's how we control access to healthcare, which is how we control the healthcare budget. And I've already said that earlier, but that point cannot be overemphasized. It is why our system operates the way it does. And when the government will hire some physicians, foreign physicians from England or Australia, mostly white Commonwealth countries, that British Commonwealth countries, after they've become fully licensed in other jurisdictions. But a Canadian who studies medical school in Oxford and graduates near the top of the class and wants to become an anesthesiologist, a surgeon, anyone but 4 disciplines in medicine, will be rejected in British Columbia. There is no avenue for them to become licensed, even though they studied at the internationally ranked university, which is #1. And again, all these things don't make sense to us who think that we are operating on the basis of need, universal health care for all, everybody can get a doctor when they need it, etc. We all know from personal experience that's not how it works. And we simply are in a system that has a fiscal policy of exclusion, and it discriminates against international medical graduates, because if we discriminated against the graduates of Canadian medical schools, there would be major political fallout. But if we can marginalize and tell people that international medical graduates are losers, they're inferior, only Canada and the United States can create, good doctors, everybody else cannot. That's a message, and that sadly, that is perpetuated by the Federation of Regulatory Medical Authorities of Canada, by the Ministry of Health, by the universities, because it serves their purposes. If they work together, they can control political thought and public information. And that's why our society had such a hard time getting the information that we needed, getting the documentary evidence that established what was going on, why we have a system of so many physicians in British Columbia, in Saskatchewan, in Alberta, all across Canada, in Ontario, who cannot become licensed to practice. It's so some of the discrimination that they face, international medical graduates are prohibited from competing for 90% of the residency positions, the entry to medicine jobs that are necessary to become licensed. So even though they're qualified, they are prohibited from applying for 90% of those positions. They are restricted in the number, the type of disciplines they can apply for. Now, Ontario, being the largest province, has more variety, but in British Columbia, for instance, you can basically become a family physician if you have a medical degree from outside Canada or the United States, or there are 3 positions in internal medicine, 2 positions in psychiatry, and 1 position in pediatrics. So you can only be a generalist. And these are positions, these are disciplines that tend to be the lowest paid. And in addition to that, another form of discrimination, international medical graduates have to meet a higher standard of qualification in order to apply for these entry-level jobs for residency positions. So to give you an example, a specific example, before an international medical graduate can apply to these entry-level jobs, they must prove that they have the medical knowledge, the decision-making ability, and the clinical skills expected of a graduate of a Canadian medical school. They must pass those exams, and realistically, to get an interview, they must excel at them. Conversely, graduates of Canadian and American medical schools do not have to take the clinical exam at all, but they do have to take the qualifying exam, which tests for decision-making ability and critical medical knowledge. Graduates of Canadian and American medical schools can fail those exams and still work as resident physicians in Canada. And the reason for that is that the government policy is to protect graduates of Canadian and American medical schools and to marginalize and provide, basically to use international medical graduates as in disciplines where they're needed, where there's a shortage, and even when there isn't a shortage, they don't allow enough. And they force them to work in areas that are underserviced. It's kind of like having, well, really, realistically, it's having a second-class citizenry, that you can control their opportunity, you can control how hard they can aspire, and you can control where they work, at least for for some time. And you can exclude them, you can exclude the majority of them without repercussion, by simply segregating them and restricting them to a limited number of spots. So there are there's so many more discrete methods by which international medical graduates are excluded to allow the government to control the number of physicians that can practice in this country. But that would take a long, long time to go. And I've kind of tried to give you an overview. So, but specifically at British Columbia, using that as an example, and I'm using British Columbia because you're BC based and because each province is a little bit different, although overall it's the same scheme. In British Columbia, if you do get an entry-level job, you are prohibited from subspecializing. You cannot subspecialize. You must work as a generalist. So it's very sad, and it's not well known, and the people in the medical establishment deal with it by deflection. They have a message that international medical graduates are not practicing because of credential recognition. Not true. Their credentials have been recognized, and because they're a threat to public safety. Well, as a Canadian who uses public healthcare system, I would much rather have an international medical graduate treating me than the person who has failed the Medical Council of Canada qualifying exams. Not that exams are the be all and end all of matters, but it is somewhat troubling to have this double standard and not to have examinations of medical graduates, particularly when Canadian and American medical schools have a policy against failing medical students. It's a little bit scary what the public doesn't know.
So I've got a few questions, and yes, I'm still here. I'm not going to fight with my webcam anymore tonight. So apologies. I'll just be looking. You'll have to look at a sailboat, I guess, when you look at me. But Rosemary, how many members, if that's the word I can use, are in your organization, or subscribers, or folks do you represent? If you had an idea, or are you maybe not a membership-based organization? So Chasma.
We welcome lots of people, and we have kind of a loose definition. We serve all Canadians who studied medicine abroad. So people who were raised and educated in Canada and went abroad to get their medical degree. And so we don't have a solid number, but the people, for instance, on our mailing list are approximately 800. Maybe more. I'm not in charge of the mailing list, so I don't know. But in addition to that, Chasma also supports immigrant physicians because I don't think there's any doubt that are the fundamental principles of justice in this country require that when a person's qualified for a job, for a position, especially for licensing, that their profession, which they've spent years training for, that the person who gets that position should be decided on the basis of competence, not on whether they went to the right school, whether they have the right associates, but on the basis of competence. And that's what the public deserves. That's what the public should need. And there's a lot of prejudice out there. And in my opinion, that prejudice is promoted and propagated by those in the medical establishment, particularly the Ministry of Health of the provinces.
So sorry, just to interrupt for a second. So I'm just trying to, because again, for the folks on Vancouver Island, in Qualicum Beach, they just announced another clinic will be closing. And here in Victoria, we've had notice of 3 clinics closing. And I'm sure in Vancouver and other parts of BC, it's a very similar story. So I just want to, how many folks, like how many IMGs are waiting in the ranks, waiting in the queue, that sort of, if, tomorrow it was announced that all would be sort of given a spot or given a residency that were eligible, what sort of numbers are we looking at? Like how many people could fill in this gap tomorrow if it were possible?
Well, in last year, there were 1,421 international medical graduates who graduated from reputable international medical schools, passed the Medical Council of Canada exams, who are qualified to work as resident physicians, who did not get and are not practicing because of government restriction on residency positions. So many others, so 1421 is the number that competed last year, many and did not get positions. Many other qualified applicants have given up as the barriers are simply too insurmountable. So how many who have qualified? I don't know that answer. I don't think anybody knows. And that's one of the sad things about our system, in that the people in control of these numbers do not make a point of publishing this information because it interferes with the narrative that they put out, i.e., that the reason that immigrant physicians are not licensed is because of credential recognition and because of fear of public safety. So if they publish this information, it would not be politically well received, in my opinion.
So for Vahid and Dr. Batool, Vahid, you mentioned, and correct me if I'm mistaken, you mentioned that you did do a residency or something. Was it 3 years? Something about 3 years? Oh,
You're muted.
It wasn't a residency. I had an educational license as a clinical training, which has been changed to clinical observership in BC, I think in 2020. And I worked in a cardiac surgery unit, helping with the assessment and management of patients after cardiac surgery. It wasn't a residency. The clinical traineeship gives an opportunity to an IMG to be in the system, work for a while, get familiar with the system, get reference letters to help with the residency application. So that was what I was doing.
In essence, to get Canadian experience,
yeah,
to make your application stronger.
Right.
So yeah, I also wanted to highlight that it's not easy to get past the qualifying exams, and there are 3 exams, and it needs a lot of money as well. Like for each exam, you may have to pay from $1,500 to $3,000. And so the people who pass these exams, it's a financial burden as well for them. And even after passing, as Rosemary mentioned, they cannot get the residency. So it's another problem, that it's another challenge for IMGs to pass those exams and then go into that stream, which is not, they are not willing to give them the residences.
Dr. Batool, when you came to Canada, did you come similar to Canada in a way that Vahid came to Canada, whereby you wanted to, the idea is that you would work as a doctor when you came here?
Not exactly, because I didn't came on the immigration as a doctor. So I didn't had, but when I came and I saw the system, and I am actually preparing for the exams, but the things are not that easy, and not that the picture is not that rosy. And it's really difficult, that the stories, if you hear, that I was reading about a doctor who came from the Kurdistan, and he was running a very largest refuge camp there, and he was seeing medical or he was doing medical operation for 60,000 people, and he was a Syrian born doctor, and spent over a decade working as a surgeon in Iraq and Syria with United Nations and Doctors Without Borders. But now in here in Canada, he is working in a medical equipment manufacturing department somewhere, right? So such doctors who have such a big experience and such a rich career background, they are not able to enter into the workforce.
That really is a crying shame, and I'm sure anyone listening would agree. I think, Rosemary, from what you've said, it sounds like perhaps it's more, I mean, from what I'm getting from the things that you've told us about, is that it's perhaps more of a bureaucratic issue than an actual physical doctor shortage.
Oh, absolutely. And I wouldn't say it's a bureaucratic issue. I would say that it's a fiscal policy management. The fiscal policy of management of healthcare is founded on restricting the number of physicians, which restricts access to healthcare, which controls the healthcare budget. That is, I'm not sure that you could call it bureaucracy. That is a deliberate fiscal policy that has been adopted by our government, that we want to restrict the number of physicians because we can't afford our healthcare system. Your listeners might find it interesting to know that how our healthcare system compares to other countries. Canada's healthcare system is consistently ranks at or near the bottom of developed countries, as Dr. Batool stated. We are the fourth last in number of ICU beds out of 36 developed countries. We rank seventh last in the ratio of physicians to population, and we consistently have the longest waiting lists. And despite quote unquote universal healthcare, 17% of Canadians report that the cost of healthcare is a barrier to care. Now, to give you a comparison, Germany is a country that spends about the same amount as Canada on universal health care. Germany has about 75 million people compared to our 38 million, and is consistently ranked one of the top rated healthcare systems in the world compared to Canada, which is consistently rated as having one of the worst systems in comparison to the money spent. Canada has 2.7 physicians and 1.4 government administrators, per 1,000 people. By comparison, Germany has 4.25 physicians and 0.15 administrators per 1,000. This is an important number. So although Germany and Canada spend essentially the same, Germany has more family physicians, more specialists, more acute care beds, more psychiatric beds, and far surpasses Canada in its inventory of diagnostic equipment. Where Canada excels as a nation is in the number of administrators. The number of government administrators is 10 times as many as in Germany. So a significant portion of our healthcare budget is taken up by administrators. Now look at this, 2.7 physicians, 1.4 government administrators per 1,000 Canadians. And that may not be that surprising if you think about the foundation of where our fiscal management policy. Our fiscal management policy is to control the number of physicians. It is not to provide the highest level of healthcare. So for instance, when I've spoken to physicians, many of them are so frustrated. As a matter of fact, the people who quit in Victoria that you mentioned, Adrien, had stated publicly that one of their frustrations was the inefficiency that the government required, that the interference and direction that the government provides them interferes with their ability to practice medicine efficiently. I've spoken to a general surgeon who's very senior, who stated that he has directives from saying, you must order this test, and then before you can do this test, before you can do this test, before you can do this procedure. And it frustrates him because as an experienced clinician, he says, all I need to do is a physical exam. And based on that physical exam, I don't need to do test A and test B and test C. I know where I have to go to get the job done. But all this costs money. All this slows down. If you have to do cost A or test A and then test B and then test C before you can do the procedure, that slows down the rate at which we can access healthcare. That then slows down how quickly or how much we have to spend in terms of healthcare budget. And so another example of slowing down, the NDP government recently announced that they are going to be putting in a new medical school to address the healthcare shortage, the physician shortage that we're experiencing. Now, many people would say, oh, well, thank God for that. But that is not an uncalculated matter, and it is not inconsistent with their fiscal policy. If you are looking at creating a medical school, particularly one in a new university, you're looking at several years of preparation before you can even get your first student on the ground. Then you are looking at 4 years in medical school before they can start residency. So you can delay having to spend or having a fully licensed physician by 15 years. And I say 15 years because in addition, they work as junior physicians or resident physicians for between 2 to 7 years. So again, that is consistent. So this announcement is consistent with assuaging the public, making it seem like they're doing something positive. But as you know, Adrien, I sent you a study from the University of Calgary Economics Department, which stated that the cost to a taxpayer is 10 times greater to educate a medical student than to hire and train an international medical graduate, 10 times higher. But again, this is not surprising that we take the route we do because we have a lot of administrators. We have barriers put up for international medical graduates. We are not concerned about what it costs because the bottom line is, how do we control the healthcare budget? And we can control that budget by controlling the number of physicians, which controls access to healthcare. And if they delay it, then they don't have to deal with it in that budget. If they delay it, you know.
And well, let's not forget, Rosemary, in addition to all of those, what I think are fantastic points, how many international medical students are going to take up some of those spots at the medical school? Some of the materials you sent me talked about, I believe it was the material you sent me, talked about sort of the number of overseas international students that we have in our medical schools and how we sort of roll out the red carpet for them in a sense of they're getting residency positions and things like that, and then they're returning to their home countries.
Oh, that's a very, very good point that you raise, Adrien. First of all, in terms of medical school itself, British Columbia does not accept international medical school, does not accept foreign people for medical school. The 288 positions we have in BC all go to Canadians. Other provinces do accept students, but the big issue is residency training. How many do we train? How many residents do we train? And the data demonstrates that, and again, this is about making sure that Canadians do not become licensed. If you train a foreigner who is under contract to return to his home country, you know they're not going to become practicing physicians in Canada, at least not in the short term. And so what we have are what we call visa trainees. So I believe that at this time we have approximately 800 resident physicians who are from oil-rich countries working as resident physicians. That most of them are from Saudi Arabia. And at the end of the contract, at the end of their training, where they've used our infrastructure, they've used our resources, and the universities get paid a handsome fee by their government, by the Saudi government or the Kuwaiti government. And then at the end, they have to leave by their contracts. So we've trained them, and then we send them on their way, again, consistent with the fiscal policy the government practices in controlling the number of physicians. What's interesting is that the statistics published demonstrate that we train twice as many. There are 2 times as many physicians from visa trainees, foreigners, in residency positions than there are Canadian international medical graduates. Twice as many foreigners who have to leave the country at the end of the training compared to Canadian citizens and immigrant physicians, permanent residents. So this is, I keep saying the same thing over and over and over again. But to understand the doctor shortage, you must understand fiscal policy, how healthcare costs, what the government has decided as to how to control healthcare costs in this country.
Yeah, no, this is such a large topic. And I think if the audience is interested to know, and Rosemary, we talked about this and we can talk further, but I think having an entire episode with you just to discuss, to really get into the nitty gritty of the policy. And I'd like to read through the Canada Health Act as well. And one final point to Rosemary's, to your piece, Rosemary, and then Vahid, I would like to hear more about your personal story, because I don't want that to be lost in the sort of in the shuffle here. I think your personal story is really probably quite profound. Just sort of the idea of coming to Canada. But just one final point, and Dr. Batool, of course, I'd like to hear how the studies are going for the exams and the rigors of those. But Rosemary, there was something else in the material that you sent me that talked about, I think it was the Canada Health Act, that sort of talked about how, there should be a physician for rural areas, and sort of laid out sort of the hopes or the goals of I believe it was the Canada Health Act. And sort of one of those things was having physicians, like all Canadians should have access to timely access to a family physician, and so on and so forth. And to think that sort of seems to be, I mean, I guess healthcare is sort of more of a provincial jurisdiction. Is that correct to some degree?
Oh, absolutely. The Canada Health Act was which provided universal health care, all health care, was enacted, I believe, in 1967. At that time, medicine was quite different. We didn't have MRIs. I don't think even our CAT scans had made it into the, common use in hospitals. And so at that time, the federal government agreed to pay for 50% of healthcare costs. But then as medicine developed and became more expensive, the federal government simply said, no, we're not paying that anymore. And the provinces, who are now stuck with the Medical Health Care Act, were put in a position where they had to do whatever they had to do to fund universal health care. And so we have a bit of a disconnect between the federal government and the provincial government in that way, but also in respect to immigration. So for instance, Vahid had told us earlier that he had immigrated under the skilled workers program. So the federal government had a skilled workers program where they expedite immigrants in areas of need. And the federal government recognizes that we have a doctor shortage. And that's why Vahid and hundreds, maybe thousands of people like him have been expedited to come to Canada because they are professionally trained. It's economically good policy to have people who are already trained to get in there and roll up their sleeves and start working. However, the provincial governments, their prime line is we don't have a physician shortage. We may have a distribution shortage, although it's hard to find. Actually, in 2014, when I asked Kevin Brown of the Ministry of Health, well, you say there's a distribution problem. Where exactly is there a oversupply of family physicians, for example? And his answer was Victoria. It was really interesting because shortly after that, and as we know today, Victoria was complaining that they had a shortage of physicians and people couldn't find doctors and so on. There's talk often that they talk about, well, in the Lower Mainland, there is an oversupply. Again, that simply is not true. When you look at the data, that data is not supported. So we have a situation where the federal government has said, we recognize that we need physicians, and the provincial governments are saying, behind the closed doors, we can't afford to pay for them because of how we're currently set up. We're not in a position to start cutting all the administrators, so we have to keep micromanaging things. And the system perpetuates itself. And the only way that our system can be affordable is by controlling the number of doctors. And if if we don't give jobs to those who graduated from Canadian schools, no matter how poorly they did, that will cause political fallout. Whereas it is much easier to marginalize, create prejudice, negate international medical graduates, particularly immigrants.
Yeah, unfortunately, my journey has been very tough in Canada after immigration. As I mentioned, I have passed all the Canadian medical exams. So when I landed at the time, there were 4 Canadian medical exams for international medical graduates. Now there are 2 exams. 2 exams have phased out. And so I did the exams, did some research at one of the hospitals in BC. I practiced under supervision for 3 years, and I passed the English language proficiency at least, I think, 3-4 times I passed, because after 2 years, they say that you need to retake the exams. The validity of the tests is just for 2 years. And I applied for residencies for 5 years, and I had excellent reference letters from Canadian physicians, and the number of residency physicians that I was allowed to apply to was very limited. So in anesthesia, there is just 8 positions for IMGs in Canada. So I was not allowed to apply to, I think the whole is around 200 positions in anesthesia each year. But the rest are just for Canadian medical graduates. And so it was very frustrating. And I think, in regard to the fiscal policy management that Rosemary mentioned, something else that I want to add is that the province in BC, they are trying to increase the number of nurse practitioners, train more nurse practitioners, and increase the scope of their practice and give them more independence in practice. So again, that's it's consistent with the fiscal policy management, because then the government will pay less to nurse practitioners. And the best solution is hiring IMGs, making more pathways for IMGs to get to practice opportunities. That's the best solution, but unfortunately, they are doing other, looking for other solutions, looking for just making another medical school that which Rosemary mentioned, training more nurse practitioners, and those are not cost effective. Those are not reasonable. In other countries, when they say that we have shortage of physicians, they just facilitate the admission of immigrant physicians. But unfortunately, that's not the case in Canada. And if we want to think how it harms the international medical graduates, I think we need to imagine that a practicing Canadian physician goes to a country, let's call it country X. Country X says that we need physicians. We are short of physicians. So he applies and goes to that country with his family. He passes the exams, applies to residency position. They say that you need to redo your residency. Redo your residency, pass the language proficiency every 2 years. And then you need to apply to residency positions. He applies for a few years. Then he gets rejection after rejection for over the years. And then, so at the end, he doesn't know why he has been rejected. At the end, he is drained of his financial resources. He is not able to get a position in other countries, including Canada, easily, because then he is out of practice. He might even need to drive taxis in country X. Okay, so if we imagine the same position just for one Canadian physician in another country, he is the citizen of that country. If he thinks he can, he would be treated the same as others, but they say you are only allowed to apply to 10% of residency physician positions. You are not allowed to apply to subspecialties. You need to go to underserved areas if we give you a residency position. And then what do you think would be the response of Canada as a country? Do you think the federal government of Canada will remain silent? Do you think that it would be just, it would be ethical? Do you think it would be right? So what do you think? I'm just talking about one practicing Canadian physician going to country X. At the end, he would be driving taxis. He would be out of practice. He would be done with his career forever. Okay? I'm not talking about hundreds of Canadian physicians, but we just, Rosemary mentioned, we have at least 14,000 internationally medical graduates who have passed the exams, who have applied and have not been allowed to practice in Canada. Okay, so what do you think? Is the system Is the system healthy? Is it working perfectly, or is the system flawed? So that's my question.
Actually, I find it very unfair to label IMGs as not properly trained or poorly trained doctors. In fact, doctors everywhere in the world pass through a very tough training, and then they are given a degree, number one thing. And second thing is that most of the IMGs are from the developing countries, and they used to work in very resource poor atmosphere there. You know, doctors here, they have almost everything there. Where I have been working, can you imagine that I did a cesarean section on a woman who came with a placenta previa type 4 and who came on the donkey cart. And I have to save that woman, and I have to save that child. So we are working, we are trained even in more tough situations. I have delivered a gravida 8 patient, and she was with hemoglobin 2 grams per deciliter. And no one can imagine these situations here in Canada. So we work in that situation, you know. So we are not poorly trained doctors. Number one thing is calling IMGs and labeling them as poorly trained is really something which hurts us, because we have been working in very tough situation, and if we and working in Canada is comparatively very easier for us if we are given a chance, and if we are given a proper representation, and the IMGs are even willing to go through the training. They don't say that they don't want to match their skills to the Canadian standards. Even if they want, they are ready to pass the exam, they are ready to go to that residency, but system is not allowing them. So it's very heartbreaking, and for many IMGs, and ultimately they end up working as a security guard, or they are working as a taxi driver, and it's all the wastage of very brilliant minds, and it's wastage of the talent. So I think it's a very big issue, and it's just the tip of the iceberg which we are discussing here. Actually, it's beyond the comprehension what we are thinking. And shortage of doctors and all these problems, I think pandemic was enough to throw some highlight, to put some highlight on this issue. And ultimately within next 10 years the problem will be more clear in Canada. And as Rosemary has mentioned, she has very well and detailed view of all the situation, and I'm really very impressed, Rosemary. Even I was not familiar with many of these points. Thank you very much for highlighting those, and those are very important. And thank you, Adrien, for giving us the opportunity to say all those things. And it's very important to highlight all these issues, and these are quite important for every Canadian. For every Canadian, it's important, because it's a healthcare, and it's a mental health, and it's everything which is important for everyone. It's not for the IMGs, it's not only for few people, it's for everyone who is living in Canada.
I would like to pick up, if I could, on a couple of points that were, because I look at it from the kind of the public interest point of view as well. And one of the things that is very bothersome is that we have the right to say, as Canadians, to say, sorry, Dr. Batool, sorry, Dr. Nilforushan, you can't come to Canada. We don't need you, we don't want you, don't come. But we didn't say that. We said, come on. They uprooted their families. They were promised by the federal government that we needed doctors. Now, the government didn't promise them a job, but common sense says that if you need doctors, and I'm a doctor and I can pass the standards, that common sense says that we were basically inviting them to come and work here. And then we break their hearts by excluding them, by making them into second-class citizens. Our Canadian system, and I feel this so strongly as a Canadian and as somebody legal, our legal system, which is the foundation of who we are and what makes Canada have the reputation that it does, is that once a person comes, whether they're an immigrant or a refugee or they were born here, they are Canadians. And they're entitled to the same respect and opportunity as everybody else. And what is going on, in my opinion, is so morally wrong and illegal as well. The second thing that I wanted to pick up on is what Vahid said about nurse practitioners. And this, again, is something that should be thought about. Nurse practitioners have an important role to play in the medical system, and they are used across the country, all countries these days, or most countries at any rate. But nurse practitioners do not have the breadth of experience, the breadth of education, the breadth of health issues that medical students and doctors are trained for. And so you have to ask yourself, is this a real savings by paying somebody less than they'd have to pay a physician? Or is it a false economy? Because I look at my profession, where you can pay somebody who's a junior, has limited knowledge in a particular area, let's say tax law or personal injury law or real estate law, you can pay that person, but they don't have the knowledge. And I can guarantee you that in my profession, if you are paying an expert in a field, that you are going to end up paying less in the long run, because they're not going to miss things and they're going to be able to deal with things efficiently. And so don't get me wrong in respect to nurse practitioners. They're to be respected. They have an important role to play, but to try to replace physicians with nurse practitioners, that doesn't seem like a fiscally responsible thing to do with my tax dollars.
Something else that I just wanted to mention, we have already talked about. So the government has the tools and resources to solve this issue, but unfortunately, there is no intention. There are internationally trained physicians already here, thousands of them have passed the exams, and they can increase the number of residency positions. They can create pathways, short-term supervised assessments called practice-ready programs in all provinces, and also for specialists. There are no kind of short-term assessment for specialists, almost no pathways across Canada. So they can easily implement those pathways. And they say that sometimes they say the issue is funding. So I believe that the COVID showed that, and financial resources. In COVID, we saw that if they want, they are resourceful. They can find resources, financial resources. So That's not the case. Sometimes they say we don't have enough supervisors. That's not the case either, because we see visa trainees come here, and there are supervisors to train those visa trainees. They can so if they stop accepting visa trainees and instead accept internationally trained graduates, so then there would be a lot more physicians here, and which would stay. So the government has the tools and resources, but unfortunately, I can't think of anything else other than that the government doesn't have any intention and any will for solving this issue with the most reasonable and cost-effective approach. In Australia and the UK, the internationally trained physicians have different pathways to get into practice opportunities. And they can easily implement those pathways here as well.
The difference is the fiscal management policy under which Canada operates versus the other countries.
Yes, I will say thank you very much, Adrien, for giving us opportunity to express our feelings. And it's really very important topic. And it's your vision that you brought it into highlight and let us spoke about it. And it's really important. And very impressed by the all the facts which are given by the Rosemary, and bit depressed by the story by Vahid. But yeah, because I can understand your feelings very well. So I'm really, it's really something which probably maybe other people cannot understand, but another doctor can easily understand how he's feeling right now. So thank you for giving us opportunity to talk about that.
I'd like to thank you too, Adrien, because I do think this is a very, very important issue, and I do think that the public is not aware of the political aspect of it and why there is a doctor shortage, which is totally unnecessary. And until people such as yourself and others bring out and ask hard questions and understand, actually in some ways, the simplicity of the policy, there will not be the ability for the public to press the government and hold them accountable, because currently the government is very good at their messaging department is very good, and they deflect from the fact that they work very hard to control the number of physicians that we can access.
Thank you very much, Adrien, for having us and the opportunity. Yeah, it's a very important subject, and we hope that it has been useful to your audience.